I'd like to start by thanking my co-authors, Hayley Walters and Natalie Warren at the University of Edinburgh, and Vlad Vancia at the University of Cluj-Napoca in Romania, and also all of the people that have contributed to this project. It's been funded by Dogs Trust and has required collaboration from a number of different NGOs who are running really successful and really impressive trap-neuter-return programmes. I think it's a big ask for any programme to allow a bunch of people in to evaluate welfare, because it's always going to be a sensitive issue. So this project would never have got off the ground if it wasn't for the foresight and the dynamism of a number of projects who were happy to allow us in to develop this assessment. So I'm going to start by just outlining the problem. One of the issues that we have in trap-neuter-return, which in many ways is a positive but can also be a bit of a challenge, is that it's our most used tool in terms of dog population management. The surgical sterilisation of dogs is probably the thing that we all think about when we think about dog population management. And because of its ubiquitous nature, its application by leading animal welfare charities, and the poor welfare implications of some of the alternative of dog population control measures, we tend to assume that any TNR intervention is by default a positive welfare intervention. But there are a variety of techniques that are used in TNR initiatives, and combined with a focus on population control and dog numbers, this can result in the compromise of welfare of the individual dogs passing through those programmes. And this can be something that's hard to reconcile. Most people that are involved in trap-neuter-return are at heart people that care about animals, and it can be quite difficult, I think, to objectively evaluate the impacts that you may be having in terms of negative welfare on animals that you're trying to help. That's something that we call cognitive dissonance. It's where we justify our actions because we're concerned about the alternatives, or we're concerned that recognising that our actions may be creating a problem is a huge psychological and emotional challenge for us. But that's one of the things that we were trying to overcome with this project, is objectively evaluating dog welfare within these very well-intentioned programmes. So just to give you an idea of some of the challenges, these are just two videos, both taken in TNR programmes, obviously different programmes. And depending on the use of anaesthetics and the types of anaesthetics that you might use, managing dogs under anaesthesia is one of the challenges of TNR. Often the focus is very much on the surgery, and it's not uncommon for dogs to experience periods of consciousness during surgery. And I'm sure that if you've been involved in surgical sterilisation, you will have experienced that as well. It can be difficult to manage depending on the types of anaesthetic. And this is not about judging any programmes, it's about trying to say, well, what mitigations can we put in place? What steps can we take to minimise some of these challenges? So this pilot project aims to produce a robust and practical audit that can be used to measure parameters across a range of different TNR programmes. There's a lot of variation in how different TNR or CNVR programmes are rolled out. And the idea is that it will benefit dogs because a validated audit process allows programmatic improvements in individual welfare to be measured. We can look at a baseline of what we're delivering to our dogs today, we can put in place some steps that can improve animal welfare, and we can reassess our programme in 3 months or 6 months and say, yeah, we've made a measurable difference. We've improved the quality of service that we're delivering to the dogs that come through our programme. And that's something which is positive, obviously, for funders and from a PR perspective as well. It was definitely a learning curve for us. What we can measure, we can manage, we can improve on. This is some of the pre-test training that we were doing. This was just in a dog shelter in Edinburgh. This is a dog displaying exploratory behaviour, which is a positive welfare indicator in pet and shelter dogs. It doesn't work in street dogs, it's useless. So that was one of the things that we found out during this process. So a lot of the indicators that are published in the literature or that people have experienced are based on dogs that are very much pet dogs, that are companion dogs, and so we have to adjust our expectations slightly with some of those measures and their applicability to street dogs. We used a process called HACCP, Hazard Analysis and Critical Control Points, and this is an approach used to identify hazards, usually in food production systems, in slaughterhouse systems. It has been applied to a variety of different animal welfare evaluations in other species, but it's not ever been applied in TNR. And the approach identifies potential hazards to animal welfare And then critical control points, so things that we can actually use to evaluate, yes, this is a welfare problem, no, this is not a welfare problem, at that particular time within a process. So we identified potential hazards to animal welfare, and then the critical control points where those hazards could be mitigated, where we could take a step and intervene and say, okay, this is something we can change, this is something we can manage. This is the HACCP process, which I'm not going to go through in any great detail, but basically what we did was decide what we wanted, which was a robust animal welfare assessment for trap-neuter-return programs. We made a flow diagram of the whole process of TNR and the different steps that we go through. We identified potential hazards both through a literature review and also through a stakeholder analysis using about 30 experts that are familiar in trap-neuter-return programs. We did a site visit to confirm the process and look at the applicability of some of the measures that we were planning on using. Based on that, we sort of finalised our list, and then we verified that at the second trap-neuter-return programme. So, as I said, we did a literature review, and that looked primarily at behavioural and physiological indicators in the welfare of dogs, and a few other species that might have utility across different species. Again, this was primarily focused on work that's been done in pet dogs, really. And we also looked at how those indicators could be applied to different stages of the TNR process, because we would need different indicators for each stage of the process. And then we sent those measures out to a variety of experts and asked them also to suggest any additional indicators that they thought would be useful when evaluating welfare through the TNR process. They were asked to score the indicators on their practicality, their economy and their reliability in terms of representing a welfare problem. And they were also asked to score each of the indicators as mild, moderate or severe in terms of their welfare challenge, because with any situation, I think, where you're taking dogs from their normal habitat, where you're transporting them, where you're performing surgery, there is going to be a level of welfare compromise. I think that's totally unavoidable. It's not a perfect system. But what we're interested in is trying to minimise particularly the moderate and severe welfare challenges that those dogs might face. We considered some physiological indicators. They're generally not practical or economical within the sense of trap-neuter-return. So then we were looking mostly at either animal-based or resource-based indicators, and these have been used extensively across many other species. So just to give you some examples of animal and resource-based indicators. Animal-based indicators are usually more accurate and more representative of the animal's welfare state, but they also require some level of training on the part of the assessors that are looking at those indicators. Resource-based indicators are easier to evaluate, but they're often less accurate at representing the animal's welfare state. And this is something that we saw in that even where a resource-based indicator had been provided, if it wasn't accessible to the animal or it wasn't suitable in mitigating the animal's welfare compromise, it essentially, even though it had been provided, it wasn't useful. So we came up with a massive list of indicators for all stages of the trap-neuter-return programme, and as I said, they were scored by our experts. And then we confirmed whether they'd be useful or not on site. So the first project that we visited was a relatively small scale project, and that was deliberate because we wanted to make sure we had plenty of time to perform the assessments that we needed to do. And it's important to recognise that when we were doing these visits, we weren't assessing the programmes, we were assessing whether the indicators we'd selected were practical, whether they were feasible within the context of a TNR programme. Once we'd confirmed which indicators were suitable for each section, we then had to consider some of the challenges. One of the challenges that the site visit really threw up for us was the ability to recognise some of the behavioural measures that we wanted to include. There was certainly some limitations that we observed on that site visit in terms of particularly things like pain recognition and whether staff within the programme could reliably identify pain. Analgesia was given in the programmes that we visited, but pain is quite a complex process, and often a single shot of a single analgesic is not adequate to mitigate pain entirely, and so there are other things that can be done even within a TNR programme that can mitigate that. One of the other things we were also interested in looking at was behavioural change, so pre and post-op behaviours in dogs, because we know that if an animal's behaviour changes pre and post-operatively, that can also be an indication of its welfare state. But in order to do that, we would need to be confident that people could reliably identify different dog demeanours or behaviours and understand how that relates to dog welfare states, which is quite a big challenge, but we wanted to see if it was possible that staff on the ground would be able to do this. We used videos to capture a variety of different behaviours, and then we tested the interpretation of these videos with a variety of different people. So first of all, we tested ourselves to make sure that we were reliably evaluating different behavioural states and different pain states. And this went through a statistical test, and this test basically tests your level of agreement, and the closer you are to 1, the higher the level of agreement. So we did ourselves, and we had almost perfect agreement between our research team as to the behaviours that we were seeing and whether animals were in pain or not, and also the acceptability or unacceptability of different catching and handling methods. We then decided to trial this on a bunch of UK-based vets and dog shelter staff. There was quite good agreement with capture and handling techniques. There was less agreement with specific demeanours, specific behavioural states, but when we then recategorised those behaviours into representing either positive welfare or negative welfare, which really is what we're interested in, then the agreement was pretty good. And remember that a significant number of vets and vet nurses in this cohort, we still only had moderate agreement about animals displaying signs of pain. We then sent those videos out as a survey to staff that worked in TNR programmes, and we had substantial agreement on the acceptability or unacceptability of different capture and handling techniques. And as has been mentioned this morning, this is an area that lots of research and lots of work and investment has gone into to try and improve that area of TNR in terms of dog welfare. We only had moderate agreement about positive or negative behavioural states, and we had slight agreement in terms of pain. So the pain assessment was something that we were quite concerned about, and that ability to recognise pain was something that we'd observed in our site visits as well. So it was something that we were already aware, could be a challenge in terms of the assessment of dog welfare in TNR. However, despite this potential barrier, we decided to include selected behavioural indicators, including pain, but recognising that it is important that any staff working within TNR are trained in recognising these behaviours and how to mitigate them. It's not just good enough to assume that because you have a vet, your vet will know how to assess pain and will know how to take steps to minimise pain. That's certainly not what we've found in this. So we then visited a second trap-neuter-return project to verify that our finalised measures would be applicable in the field and would work at a much higher volume situation. And 3 of us followed dogs for 5 days, observing all stages of the TNR programme. And what we found with the project, with this project, was that the checklist worked within the 2 systems that we trialled it in. What we'd like to do is to make it available for more TNR projects to be able to apply it within their own setting and gather feedback on how practical and applicable it is within a variety of different settings. What we found was some really amazing work done in terms of trap-neuter-return and in terms of the amount of staff training and investment that's gone into improving dog welfare in the projects that we visited. I was enormously impressed with both of them. But we also found some issues, particularly in terms of veterinary capacity, and as a vet, obviously this is an area that I'm particularly interested in. And that included things like breaches in aseptic technique, pain recognition and management being a real issue, despite the provision of analgesia in these projects, anaesthetic control and the monitoring and maintenance of anaesthesia, and even in some cases resource provision, so the provision of post-operative water being an issue potentially, and then lack of individual dog assessment prior to release, so animals being released according to a specific timetable rather than regardless of whether they were fully recovered or not was a bit of an issue. So these were the main points that we found as potentially being problems. It's a very small sample number, and as I said, I'd be really interested in anyone that might want to sort of roll it out or try this within their own project. It's just an example of a section of the post-operative checklist. Things that are positive are things that we would expect to find within a TNR programme. Things that are negative are things that we would expect to not find in a good TNR programme. And this is just a video to demonstrate how challenging this can be. So these are post-operative dogs. This is, there's a resource issue in terms of provision of bedding. The dogs on to the right all have access to a bed. The dogs on the left don't. And you can see the difference in how pain behaviour is expressed. The dogs on the left, I hope you'll be able to recognise, are displaying quite significant behavioural indicators of pain in terms of hunched body posture, tense facial position, and also looking and sniffing towards their incisions. The dogs that are resting don't. This is a non-painful post-operative dog. That's the only non-painful dog in that video. So whilst all the others might be normal within a TNR situation, it's really important that we don't let normality override what's acceptable or unacceptable in terms of, particularly in terms of pain management, which I think is fundamental. Very simple things you can do. This is a local anaesthetic block into a surgical wound, cheap as chips and requires basically no training. And I'm out of time and the battery's died. That's fine, it was my last slide. So I'd be happy to take any questions if I have time. I don't know if I do. Thank you.
There's still time for a couple of questions. Anybody having a question for Dr. Bacon? Nobody? In that case, may I ask a question? How do you see this protocol being able to be used as a self-evaluation tool, or will it be possible, you think, or beneficial to also allow benchmarking to see how one project does against another one?
I would see it being used as a self-evaluation tool, and I would hope it would be something that programmes would adopt, because we all care about dog welfare and we all want to do a better job, and this is a tool that allows us to do that. I don't think benchmarking is necessarily useful, just because the variation in different approaches to TNR are quite considerable, and I think it's quite difficult to judge some programmes versus others depending on the situations that they're working in. There'll be differences in just the logistical challenges that they face in terms of different capture techniques or different time periods for release of dogs after surgery and that kind of thing. So the majority of indicators that we've included allow for, they won't be applicable to every single programme. It will depend a little bit on your individual circumstances. But they allow enough flexibility that each programme should be able to evaluate itself. But I don't think it's appropriate really to be looking at comparisons between programmes, because the resources, the logistics, the challenges that they face a lot of the time are quite unique. If that makes sense.
I see there one more question.
Hi Heather, thank you very much for bringing up some of these really, really key issues in TNR programs, among others as well. I think they're really important. And I'm wondering if, I know this is an extension beyond what you're studying, but I wonder if your team has any thoughts on motivating the changes in the behavior of veterinarians. I mean, as I'm sure you know just as well as I do, one of the first things that you get when you say, oh, we need to improve analgesia and aseptic technique, and the pushback that you invariably get is, well, it's been working fine until now, right? And so I'm just wondering if you were having any thoughts on how to change those kinds of attitudes and then motivations, short of starting something like what, starting completely afresh, like what Joy is doing.
Yeah. I think it is a huge challenge, definitely, and I certainly don't have all the answers. I think in my experience, one of the big barriers to change has just been a simple inability to recognise pain, or a simple inability to not understand the alternatives that are available. A lot of TNR programmes that I've seen will use 2 or 3 types of antibiotics. You don't need to spend money on those resources if you're doing sterile surgery. You shouldn't be introducing bacteria into the wound. You could take the money that you save on that, spend it on analgesia, because TNR surgery you shouldn't be introducing dirt into your incision, so that shouldn't be an issue. But we do know that you are causing pain by necessity of the surgery, and so you should always be giving multimodal analgesia, ideally. So I think it's partly education. In terms of motivation, I think it comes to enforcement by the programme managers and staff training and recruiting the right kind of people that actually want to make a difference.
I've got a question over here. Heather, couple of comments. One is, I suspect that the data that you showed on the TNR program in terms of post-op or surgery would probably be about the same if you went to an average private clinic. You know, I mean, aseptic technique. I know that in Tufts there were clinics where the surgery was downstairs, and every time somebody walked across the top, dust would float down. So, I mean, you know, these are the sorts of things that you see in private practices. It's getting better, I'm sure, but it's still an issue. The other thing is that when you sort of look at individual welfare versus population measures, we have this discussion currently going on about sterilization in general and whether it's good for the individual dog. And there's some debate about whether it is good for the individual dog, because you get increase in some disease states and a decrease in other disease states and so on. But the overall impact of sterilization, say in the United States, has been huge. We're saving millions of dogs that are not being killed in shelters every year because of the sterilization issue. And that tends to be left out of the equation. So I just make a plea that as you consider this thing, you talk not just about the individual, but also about the larger social issues.
Yeah, I think that they're all really good points. I would probably disagree with you in terms of the private practice, but again, it depends on the level of private practice in the situation that you're working in. From a welfare perspective, I don't think we should be aiming for the lowest common denominator. I know that potentially some of these measures might be aspirational for some projects, but you know, we've got time ahead of us, and if we can measure some of these things, we can start that journey to making some improvements. And whilst I think a lot of projects are often focused on the population level, and that's a necessity because what this is all about is controlling dog populations, I think it would be a real shame if the individual welfare, if we got this cognitive dissonance, this idea of, oh well, you know, the individual doesn't matter because we must focus on the population and that's what matters, and we discount individual suffering, a lot of which is actually very preventable, very cheaply and very simply, just through training and perhaps a bit of redirection of resources rather than any additional spending.
Thank you very much for the presentation.